The prevalence of infant falls is surprisingly high. There's an estimation from the CDC that approximately 8,000 children or ages 0 to 19 a day are seen in emergency rooms. Falls is becoming a lot more of an awareness factor now. Um, it's interesting enough, about 4 years ago, 5 years ago, all the children's hospitals got together and looked at big safety factors of which they can help prevent in the hospital. And there was an underappreciation of what falls or what pediatric falls are all about. We're taught in medical school and residency about adult falls, seniors falling, breaking their hips, pretty commonplace. But no one really talks or gets educated about falls outside of child abuse. As a result of the 4 years ago, there was a national program of monitoring, of setting up how to monitor for patient falls in hospitals because people realized that depending on the hospital, the rate of falls of kids in a hospital may be about a third of the rate of medication errors. The typical injuries that would be seen are isolated injuries, contusions, black and blue marks on the forehead or on the side, or a little redness. Now, in actuality, most kids fall and they're falling on their butt or they're falling down and you see no marks whatsoever. Rare cases would be a fracture. That if a child's going down and bracing their arms down to fall, they can break their wrist like anyone else can that way. But primarily, it's the isolated black and blue. In terms of scenarios in my history, now I have a background in intensive care medicine, so I would see probably the worst of the worst. The biggest fall I've ever seen is someone falling downstairs. I got to the top unattended, and they fell, and they unfortunately did break their neck and had a severe brain injury at the same time. The settings actually where falls occur can almost be anything in terms of mostly it's the home, because that's where the children and infants are most likely to be. It also can be in playgrounds because kids are left usually playing around and fall off of different things that are there. Usually take a child out to a playground and everybody thinks, oh, it's a pretty calm area, but that's one area there because you usually have sand and soft surfaces, which is good, but that also creates a situation where a child could fall because of the friction. Um, Going over rugs, hardwood floor to rugs, there's a little bit of a step up and a little friction that way that can cause a fall. Dogs and pets. Kids like to grab onto pets and walk with them. And the children are just starting to take some steps now. And that is not a secure way of a dog is not a secure holder for a child walking. Children could be on some medications, seizure medicines, sedatives, some of the behavioral medicines, and be a little bit drowsy themselves. So you wouldn't think that these medications could cause drowsiness or falls, but you can trip and fall as easily as if you were 90 years old. So if somebody falls, a child falls and has an injury, a lot of times parents may think, oh my God, are they going to suspect this is child abuse? And that should not stop somebody from going to an emergency room and getting your child checked out. Telemedicine has been a game changer in terms of access. You can call right away and within minutes now, instead of days, actually see a pediatrician or a nurse practitioner. So if you're concerned at all, was this a significant injury or not, or seeing my child, you're just a phone call away, which is good. I think in terms of the demographics of who's around with falls, I think there really hasn't been a lot of published studies about it. It's happened even under supervision when you've had two parents or grandparents. I'm a grandparent now, and I worry about that. I'm an experienced grandparent. But I think the more likely you have one single person there, the more likely they're going to be unattentive. They're going to be doing multiple things. And so the more likely that by yourself or doing other things is the more likely you're going to have problems. If you're tired, you're the only caregiver, and you've just worked and you're sleeping, and the child's moving around, those are the setups because an infant or a child does not know or anticipate they're going to fall. They're inquisitive. So you may take a nap or sleep or fall asleep, and they're going to still be on the go. So I would say situations where you're the only caregiver are more likely that those are the situations where it's going to occur. And actually, this is not unheard of to actually tour a house, take the telemedicine, and or ask your pediatrician, how do I foolproof my house? Is this right? Can I do it this way? And you may get some nice ideas, or someone may observe behind you Oh, you have a couch there. I see that. But I also see that you have a couple of things stacked on each other. Your child may climb up there and fall off it. So it's the medical aspect, which is good, increases access, but it's also the observation also that may occur, which is benefit. If you think about it, with COVID-19, what's happened is that people have stayed isolated. And so they're spending a lot more time in the home. Um, there are a lot of behavioral issues popping up. There's a lot of boredom issues, behavioral issues, and I think where this issue is starting to pop up is people may, even though they're there at home with a child, it doesn't necessarily mean they're more attentive. I think it's just a matter of the number one caveat here is to stay attentive to the child or the infant. It's not a car accident. It's not a gunshot. So those things are horrible things that have happened, and falls are very prevalent. Um, but it also means that people sometimes can lose sight of the fact how important this is and how what a huge problem is. It's the leading cause of non-fatal injuries in infants.